Nice.
It was a dark and stormy night in a city that never sleeps. It'd been a quiet night so far for Health Inspector Joe Maintoo. He had just spent a good 2.5 hours filling out his daily activity sheets when the phone rang out.
Hello.
Joe? Joe Maintoo?
Yeah, this is Joe.
Joe, you won't believe what I just saw. The scariest thing ever.
Whoa. Slow down, sweetheart. You're more wound up than a alarm clock on a Victorola.
Listen, Joe, I just saw a very sick man working as a cook down at the diner.
Oh, yeah? What made you think he was sick?
He was pale and coughing and had a fever, apparently. He was mumbling. I couldn't understand a word.
Well, don't you worry about it, doll. Not now that Joe Maintoo is on the case. This paperwork can wait. The city needs me.
So across town, Joe would find his worst sanitarian nightmares were coming true at the Adolf de Fleur Cafe.
That's you, Anita, Juanita.
So, hun, what'll it be?
Oh, I'm not here to eat anything. I'm here investigating that you got a sick cook fixing food in the back.
Oh, you mean Sam. Hey, Sam! You got a G-man out here to see ya. What's your name?
It's Joe. Joe Maintoo.
Well, look, Joey, when you're done giving Sammy a hard time, come back and see me, will ya?
Are you Sam? Sure. Your name's Joe. Joe Maintoo. I'm here to conduct an investigation. It seems you've been serving food while you're sick. Sure.
Joe could tell this was the man he was looking for. Tall, pale, the kind of guy you'd normally expect to find stuck behind a desk all day analyzing attack rate tables and calculating standard deviations. But something was different about this one.
Look, buddy, there's 13 diseases listed in the food code that say you can't work with food. Seems to me you got all 13. I'm afraid I'm going to have to conduct a formal investigation. But first, I'm going to have to contain this situation.
Sam looked to be about 50. It'd take that long just to get that mean. Joe went down his list of reportable symptoms. Nausea, vomiting, diarrhea, cough with fever, and jaundice. Sam had them all. Next, he asked everywhere Sam had eaten in the last 10 days. Taco Hell, Hardley's, and McDinney's, all the local joints. This wasn't going to be easy.
Look, Sam, you're too sick to work here. I'm going to have to contain this situation and prevent you from working with food. But don't worry, Sam, old boy. As soon as the doc says you're healthy enough not to make anyone else sick, you can come back to work. Grrr. I tell you what, I'm no doctor. I'm gonna have to make a call downtown and get public health nurse Nightingale on this situation. Meet me tomorrow at the health department, noon. Address is on the card.
Next to the spatula.
So Joe had called public health nurse Nightingale the afternoon before. He gave her all the details in that HIPAA-compliant way she loved. Name, age, address, and symptoms. Nightingale was a real piece of work. If Joe really wanted to crack this case, he was going to need some help from her.
Sam, you don't look so well. Oh. Oh. What?
Grr.
Oh, I can't understand a word you're saying.
Grr.
Well, I tell you what, I'm gonna need a translator. If I'm gonna do right by those linguistically challenged folks, I need a translator. Wait a minute, Sam, Just sit here and wait. I'm gonna get me a translator.
Sam wasn't very friendly. He just sat in the corner of the exam room staring at Nurse Nightingale. He kept looking at her and waiting, like a guy feeding arsenic to his rich aunt. But Nightingale knew just who to call. Within minutes, a translator was on the line, and Nightingale got most of the information she needed. Now she needed to get some samples for the lab to confirm what she suspected.
All right, Sam, old boy, this is not gonna hurt a bit. I'm gonna need to take some blood, so I need your hand, all right? It's not gonna hurt a bit. Here, let's take some blood. Oh, God. Oh, wait a minute, I have to put it in the...
It starts shooting.
Oh, God, he's so sick. Well, I guess I'll need to send the whole thing in for a digital exam. Oh, golly. That is nasty gross. Something happened to my clips. Oh, is my hat still on? Oh, boy. Public health nurse Nightingale. Sam, we are not finished. Sit down, please. We need to fill out some paperwork. All righty, first we have this canary colored paper and triplicate, and you need to use a black pen for that, please. All righty there. Oh my golly. I gotta get those specimens sent off to the lab. Now you need to fill the pink sheet with, I think, black ink. Okay. No, not there. Not there. That is for office use only. Oh gosh. Where's the translator when I need it? Okay. Oh, all right, we're finished with that.
So
Okay,
Nightingale
Sam.
packaged up everything and sent it off to the 24-hour emergency lab the district contracted with. She knew she'd have a result soon,
Oh,
but
boy.
as she took Sam's now completed form,
Oh, gosh.
something caught her eye.
Sam, your last name is Monella? Monella, Salmonella. His name is Salmonella. I think I know the problem now.
So having removed Salmonella from the diner, Joe and Nightingale felt as proud as peacocks. Only one thing remained: to make sure the district never saw another case
Yeah.
like this one, and to explain the whole thing to the chief.
How's that sucker, buddy? His name was Salmonella. Oh, his name was Salmonella. Can you believe that?
Look, look, sweetheart. There's nothing in the rule book says I gotta ask a guy's last name.
Well, look, sweetheart. Let's tell the chief that we need a new policy book so that we can have that information ahead of time, sweetheart.
So,
Uh-oh.
I heard you nearly let a cook named Salmonella cook down at the diner.
Look, Chief, there's nothing that says in that big old honkin' book of policies that I gotta ask a guy's last name.
Well, now there is. We gotta keep this place safe. We have to follow our policies and keep them current. What do you think, Nurse Nightingale?
I think that's a great idea, Chief. Boy. That's a big old book of policies.
And so the district went back to normal. The crisis was over. Maintoo went back to his activity reports. Nightingale looked at her TB cases, and good old Sam, he went back to his work at the Adolphe de Fleur Cafe. It would be years before the district ever saw another case like this. They got good at what they did, real good. Conducting investigations, containing outbreaks, taking lots of lab samples, and drafting strong policies. Because that's what it's really about, keeping the people safe in the city that never sleeps.